Well, a number of provinces, including Ontario, Alberta, British Columbia, Manitoba, they've jumped the gun on any formal recommendation from NACI and have started offering the ASTRAZENECA vaccine to people aged 40 and over because doses of ASTRAZENECA are sitting unused at many pharmacies because of vaccine hesitancy. Let's follow up on the latest developments in the pandemic with Dr. Zain Chagla. He's an infectious disease physician at St. Joseph's Healthcare in Hamilton and an associate professor at McMaster University. Dr. Chagla, first of all, thanks for taking time to speak with me. It's good to see you.
No problem.
Let me look. The National Advisory Committee on Immunization called off a news conference today at the last minute, just moments before it was supposed to begin, where we were expecting NACI to announce a change in guidance for the usage of the AstraZeneca vaccine. And then we have a reported case, another one, the third one in Canada now, of blood clots linked to AstraZeneca, or at least in a patient who received the AstraZeneca vaccine. That's in New Brunswick today. And I guess I'm wondering what your thoughts are on that, about the last minute cancellation, because NACI said it basically wants to review its data results before changing its guidance. What do you think's happening?
Yeah, I mean, I guess one of two things. One is, how much if this was an internal case, just based on the numbers that have been administered in Canada as compared to the internal cases. I think this is potentially the third, what the percentage is and how it relates to the global population. The other is that another country or other countries are starting to accumulate more data in this context, and a better estimate in terms of exactly what the risk is being kind of conveyed. But again, this is just caution and care as you make a large recommendation. I think NACI is charged to be an arm's length organization that makes pragmatic and practical representation for the use of vaccines. And so you would rather this be careful and not change a few times, and again have a consistent message.
Are provinces right to begin using AstraZeneca to vaccinate people over 40 in those high COVID areas? Is this the right move now?
Yeah, I mean, I think you take the argument that it's very different, the risk benefit discussion in different places. If we were in PEI right now, where things aren't particularly high from a COVID standpoint, and you have a 1 in 100,000 risk of a serious blood clot, then you may make the argument that, hey, the average 18-year-old or 30-year-old or 40-year-old seeing COVID-19 is going to be low. The average of them having complications is going to be low. And so that percentage still favors a little bit more risk than benefit. In Ontario, the situation is completely different, right? The average 40-year-old has a decent shot of being exposed to COVID-19 in the world we're living in, particularly in dense areas. And add to that, that means a risk of complications and hospitalization. Right now, a 40-year-old faces a 18 to 20 times higher benefit of getting this vaccine, preventing ICU and death, as compared to the risk of complications. So those arguments are dynamic based on the epidemiology in the provinces, but I think it's fairly reasonable to consider what we're doing right now to represent the vaccines appropriately and get them used by the populations to slow down the pandemic, which benefits everyone in Ontario, BC, Quebec, and Alberta.
Let me stay in Ontario for a moment. We're seeing some fast-moving developments in the province of Ontario now in terms of attacking COVID-19, not just the administration of vaccines. Pharmacies now in hotspots, some of them staying open 24/7 to administer vaccines. We now have the Ontario government talking about moving to provide, well into the pandemic now, sick leave for workers. What do you think of that?
I mean, it's well needed, right? I mean, from a public health standpoint, you always want to target the routes of transmission. And it's been very clear that this is a large route of transmission. Regardless of lockdowns and restrictions, this population, particularly of workers that have to be at work, are constantly exposed to the pandemic. And good data suggesting in the second wave, there were the highest number of cases in Toronto, the highest number of deaths in Toronto or related to those communities. And they were the highest population to get the variants of concerns in the Toronto and Peel area. So, supporting that population is going to support all of us, making sure that people make an appropriate choice to stay home, get tested, get vaccinated, and not face financial repercussions based on that is good advice for all of us. And I think it's an actually cost-effective intervention, noting the cost of hospitalization ICU stays in this population, as well as protecting the rest of us who have the opportunity to work from home and really just making sure that we care for the people that are not able to do that.
Yeah, and I wonder how much of this now is, like as I say, things are moving quickly in Ontario. You touched on Peel region, now saying that it's going to be closing down any businesses where they've had 5 or more cases of COVID in the last 2 weeks. So those things seem to be falling into law. If they start closing down businesses and telling employees to stay home, those employees are going to need some sort of support. And I'm wondering if almost the provincial government's being prodded into more action here by the actions being taken by local public health officers.
Yeah, I mean, it certainly contributes, right? And I think Dr. Davila, Dr. Lowe recognize what workplaces have done in their regions and really put that Section 22 legislation in to help control workplace outbreaks, which have led to community outbreaks and community cases. So, I think this is the province recognizing it. The data is adding up that this is really what's represented in our ICU stay. Yeah, it's the major issue here for sure.
Let's finish on this. In the same vein, I guess, significant pushback coming from health experts and the health table in Ontario, speaking out now about their frustration about some of the advice not being followed. Where are we now in this? In what looks to be a fracture to me between the health experts and the politicians.
Yeah, I mean, the science table is really making good recommendations based on evidence. The provincial government has a large task, and no one ever wants to. It's a tough position to be in because you have to balance all these stakeholders. The evidence is there where it's transmitting. The evidence is there that it's not transmitting in outdoor settings, which is a little bit of the kerfuffle on the weekend. It just needs to be respected. And I think, the science table's job is just to be transparent in their science and where they think is going to make the intervention based on the evidence. It's the government's job to implement it, but I think there's something to be said about the experts making those recommendations, especially in the third wave, and having it followed as part of our provincial strategy.
All right, Dr. Zain Chagla, thanks for your perspective tonight. Appreciate it.
No worries.